Welcome into the Cool Grandpa Podcast. This is the podcast where we talk to grandfathers, adult grandchildren, and experts in areas of importance to grandfathers. Whether you're a new grandfather, a seasoned pro, or somebody interested in learning about relationships, this is the place for you. So come on in, join us as we learn together, laugh together, and support each other on the Cool Grandpa Podcast. Hey, we've got another great episode for you with Richard Capriola. Now, Richard, or Rick, is the author of The Addicted Child. Rick has spent his professional career studying and helping children with mental health issues as well as addictions. Now, Richard has been licensed in Illinois and Texas. He's recently retired from the Menninger Clinic in Houston, where he worked as an addictions counselor for adolescents and adults diagnosed with psychiatric and substance abuse disorders. What is great and what I appreciate Richard doing is that he comes on and provides me with a summary of the University of Michigan's annual study around addiction, around substance use and abuse. And for those of you that don't know about this study, this is a study and a survey that University of Michigan sends out to middle school and high schoolers. It tracks trends, right? So it tracks, how early do people start using alcohol? How frequently do they use it? How frequently do they use other substances? And this is really helpful education material for not only clinicians, but also for parents and grandparents. Couple of the things that we're going to dive into that you may or may not know about is a substance called Delta 8. We are definitely going to be talking about that, educating myself on this, as well as we're going to talk about fentanyl. And we're even going to talk a little bit about sugar, right? And the addictiveness of sugar. Although it's definitely not the same thing as heroin, there are addictive properties to this, and this is why sugar is in just about everything that we end up consuming. If you would like to help out this podcast, I'd appreciate it if you go to buymeacoffee.com. That would be great. It helps offset some of the costs of the podcast. I've also got a link off to the side in the show notes. So it's really simple. If you're looking at the show notes, you've got a link right there. You can go in and contribute to the podcast that way. For those of you that are listening on Google and the Google Podcast app, remember that's going away here in about 4 weeks. So you need to start to migrate off of Google and go somewhere else to listen to the podcast. And then if you haven't listened on Apple for a little while, Apple's changed things up. So you need to go back in and you need to refresh the downloads for not only this podcast, but other podcasts where you may have skipped over a few episodes, just to make sure that those episodes are now staying active in your feed. That's really everything that I've got to cover. And so I hope you enjoy this conversation with Rick. I know I learned a lot. I continue to learn a lot. And then please check out the show notes for the University of Michigan, that survey, as well as links to helptheaddictedchild.com, which is the website that has all the information that Rick has to share with you, including how to order his book, The Addicted Child. Without further ado, let's get on with this conversation. Hi, Rick. Welcome to the Cool Grandpa Podcast. I'm excited to have you on.
Hey, Greg, it's nice to see you. Thank you for inviting me to the program. I appreciate it.
I've always enjoyed having these talks over the last couple of years, ever since we did an interview about your book, The Addicted Child. I've enjoyed getting these updates that you send me from the University of Michigan and just understanding a little bit more about what's going on with the teens and these grandkids.
Yeah, it's, I'm a grandparent myself, so I think it's very important that grandparents, as well as parents, obviously, keep aware of what's going on, just to be informed about what's out there, because it's changing and it's hard to keep up on it. But it is important that grandparents know about this stuff that's out there.
Oh, it is, because growing up, my frame of reference was Cheech and Chong back in the 70s, right? When it came to drug education, it was that, that was kind of the thing. And I know it's changed so much more. So this is really vital, important information for parents and grandparents to really know what's going on.
It is.
One thing I'd love for us to talk about is you sent me the University of Michigan's annual study, and I was curious about how did it start? How reliable is it? How do substance abuse counselors use this information? Because it's great information, but I'm kind of curious a little bit of the background of it.
Yeah, this is a great study done by the University of Michigan. It's called Monitoring the Future. And they have been conducting these studies since around 1975. And each year they do a survey of a random survey of 50 some thousand kids in grades spread out through grades 8, 10, and 12. So they are sent these surveys. Parents have to approve their participation in the survey. Parents are informed about it, and then it's done by computer. It's anonymous, and kids are asked not only about drugs and what they're using and how often they're using, but it also surveys their attitude about drugs. Do they think drugs are harmful? Do they think drugs are risky? How easy is it for you to get drugs? So it's a fairly comprehensive picture every year of what's going on with adolescent substance abuse in the country.
Well, that's great because I know, and you do too, when it comes to marketers, whether we're talking about nicotine vaping products or flavored alcohol or whatever, marketers are sure out there talking to young adults about this. I'm not going to say they're talking to kids, but they're definitely talking to those that are just across the line from being able to consume about what their tastes and preferences and views are.
Oh, absolutely. They stay on top of it. It's very sophisticated marketing and research, and they have good insight into what these kids think and what they're attracted to, what they like and what they don't like.
When we go through this, one of the first parts of this study is about alcohol use. And I thought it was kind of interesting that the study seemed to indicate that alcohol use seems to be tied when the youth are exposed or initiated to alcohol, meaning that I think if they didn't, let's say, have their first experience with alcohol until later in high school, they probably weren't as likely to participate. But if they started in, let's say, middle school, it seems like there's a trend that would continue and even, I don't know, escalate might not be the right word, but it seems like the earlier that they start it, the more that they will consume.
That's true. The earlier that they get exposed to alcohol, they start using alcohol, the more likely they are to develop what we call a substance use disorder, alcohol use disorder. It tends to, focus on boys, although girls certainly are drinking too. About 68% of boys and 64% of girls are exposed to some type of alcohol use. About 7% of boys develop the alcohol use disorder, and 4% of girls develop an alcohol use disorder. That's really where it becomes diagnosable as an issue. Boys tend to binge drink more than girls. And for those kids who drop out of school, they're more likely to be drinking and using drugs. So alcohol exposure, particularly at an early age, carries a number of risk factors, in terms of their academic performance, their ability to get through school and move on. The earlier they are exposed to alcohol and start drinking alcohol, the more severe and the more negative the consequences can be.
Looking at it from a parent and grandparent perspective, I almost feel like, knowing that this is starting the survey with middle school through high school, that if you're thinking that you need to wait until your child and grandchildren are 15, 16, 17 years old before you start talking to them about alcohol and even some of these other substances, you're really behind in the game. And chances are that youth has already been exposed may have tried it. And so it seems like the communication and starting to talk about this and using the science. That's what I loved about our other conversations, and what you talked about is using the science with the kids, but not being afraid to have those conversations earlier in their lives.
It's very important to have these conversations early in life. And as I think we discussed in an earlier opportunity, what kids seem to focus on is the neuroscience behind drug use, the brain, how their brain works and what substances can do to the brain. That's an area that I think parents and grandparents can use to sort of get these kids motivated and interested in talking about it. They're not going to respond to telling them drugs are bad and drugs are harmful and drugs are illegal. They already know all of that, and they don't care about any of that. But what they do care about is their brain, and they're curious. They want to learn about things. So as a parent and as a grandparent, I think at an early age, and I'm talking middle school and maybe a little bit before, you can start to have discussions about how important the brain is, what the brain does, what the different areas of the brain do. Get them interested in learning about the brain and protecting the brain. And then once you've done that, and they have an understanding of how important the brain is and the need to protect the brain, then you can move to the next part, which is talking about how drugs work in the brain. So first you teach them about the brain, then you teach them about drugs in the brain. And you can begin that early stage of educating about the neuroscience and the brain. You can begin that in middle school and even in late elementary school.
Oh, sure. Well, and I love that approach on a couple of different levels, because, and I think you can use a child's interest in their future interests, because certainly by when I was 12, right around 6th grade, 7th grade, I already had ideas that I wanted to fly airplanes. I wanted to go into the Air Force, or, whatever that is. To me, as a grandparent, I might be able to use the future ambitions of the grandchild as a way of saying, hey, you know what? The Air Force isn't going to take you if your brain's all messed up. And if you mess it up because you're doing these things, you've already limited your future possibilities and your hopes and dreams.
Yeah, that's a good point. If you can tie in what their interest is at a young age, what they're interested in doing when they grow up, and yes, that's going to change from year to year, but if you can tie in what they want to do and what they want to become to the importance of protecting their brain and how drugs can really handicap them and hold them back, then I think that's an excellent discussion that parents and grandparents can have with their child.
Another question, too, that I had around the alcohol survey is some of the different factors around, and we brought it up, the differences between boys and girls, but when it comes to the type of alcohol consumption, for example, I'm just going back to my old days, it seemed like the young ladies really preferred the wine coolers, the flavored beverages, where the boys, maybe it was a macho thing. You just jumped into a bitter tasting beer or something along those lines. Have there been breakdowns in like the types of alcohol to the sexes?
I think generally boys do prefer beer. Girls will tend to drink beer, of course, but maybe more wine than perhaps boys will do. And now with these flavored alcoholic drinks, I think that's attractive to both boys and girls. Girls might not have gotten into it, and now they have these flavored alcoholic beverages that might be more attractive to girls than say drinking straight beer. But as a general rule, I think boys tend to binge drink alcohol. Girls, if they binge drink, may get into maybe the wine or the flavored drinks, and certainly they drink alcohol too. But,
sure.
But I think that the boys tend to binge drink with the alcohol.
Yeah,
I mean with the beer.
Right. Well, and like I said, I remember back to my old young troublemaking days, is that it did seem to kind of feed on itself a little bit. So it's definitely a game of one-upsmanship. at a certain point, which isn't a healthy thing at all. I'm not encouraging anything.
That kind of competition is
Yeah.
it can be harmful.
Yeah. Sometimes, that's, you survive things that in your youth that you probably would regret later on. But
you wonder how you survived it.
Exactly. Some of the findings that I liked too about this, or that I didn't like, but it seemed interesting, was that the marijuana use seems to remain high amongst the substances. And we talked about this before, is really, it seems like alcohol, marijuana, and nicotine seem to be the top substances that get used and abused. But it was interesting that the marijuana use has not returned to pre-pandemic levels. And I was wondering if the study, if you had any details, did they include just smoking marijuana, or did they also include like the edibles and some of the other ways that you can partake outside of vaping?
It's mostly, regular smoking of marijuana and vaping of marijuana that they focused on. And, fortunately, most of these drugs have not returned to the pre-pandemic level, with the exception of alcohol. Alcohol has returned to the pre-pandemic level, but all other drugs, including marijuana, are still below what they were prior to the pandemic. Pandemic had a tremendous impact on teenage substance use. It drove down the rates of use significantly because, kids were at home. They were locked down. They weren't in school. They weren't with their friends. So as we expected, there was a dramatic decline in teen substance use. Well, now as we move forward from the pandemic, what we were curious about was it going to return to what it was before the pandemic? And the answer is no, not yet anyway, except for alcohol. And some of that might be a result of the fact that when kids did not have the exposure to the drugs during a pandemic and their substance use went significantly down, it seems that had a lasting impact on whether or not they were going to get back into it when the pandemic passed.
Oh, sure. Well, and also the exposure at the younger ages, too. Like we were talking about with even alcohol, is if you weren't exposed to it at a certain point, chances are you weren't really going to partake. And I forget, you know this better than me, but it's almost like if you never smoked cigarettes and you made it to like 18, like you had like almost zero chance of ever picking up smoking.
Absolutely. The longer we can delay a child starting to get into substances, the less likely they're going to get into it once they move past adolescence.
With the movement towards marijuana vaping becoming more widespread, do you think the youth are moving away from smoking and more towards vaping and other forms that they can hide the use? I mentioned edibles, but there's other ways now that are on the market wide open.
Absolutely. What we have seen is a historic low in cigarette smoking, all-time low. Cigarette smoking is at an all-time low. Kids have switched from smoking cigarettes and cigars to vaping nicotine. That's how they're getting their nicotine now. They're doing it through vaping.
Mm-hmm.
And prior to the pandemic, for 3 years, vaping, both nicotine and marijuana vaping, were just surging. The numbers were dramatically increasing. And there still is a high percentage of kids that are vaping nicotine and vaping marijuana. It's the primary way that they're getting the nicotine and the marijuana. So cigarette smoking has pretty well dropped to all-time lows, but nicotine vaping is still a concern. And the issue with nicotine vaping is, unlike cigarette smoking, where you get nicotine and carcinogens, with vaping nicotine, you're just getting pure nicotine, none of the carcinogens. So kids sometimes think, well, that's got to be safer than smoking cigarettes. Well, not necessarily so. You're still putting a substance into your lungs and your respiratory system and into your brain. But nicotine also, the vaping is easy to conceal. It's easy to hide. Kids will take these nicotine vaping pins. They'll take it to school. They'll put it in their pocket. They can use it in the restrooms. So it becomes more hard to pick up on and detect. But there's no question that nicotine vaping and marijuana vaping is a major issue among the adolescent populations, and it has been for a number of years now.
Well, and I wanted to ask you too, with the vaping with nicotine, what does nicotine do to the body, and how does that affect it? My understanding is maybe it's a stimulant, but maybe you can talk about that a little bit more.
It is a stimulant. I think the primary dangers are respiratory because you are inhaling a substance into your lungs, and that's not healthy. Also, like all substances, it eventually hits the brain. And it starts to build up a tolerance, and you become addicted, so-called addicted to it. You start to have cravings, and pretty soon your use goes up and up and up, just like smoking cigarettes, because nicotine is nicotine. It doesn't matter if you're getting it in tobacco with the carcinogens and all the tobacco stuff that's in there, or if you're getting it just through vaping where you're getting pure nicotine. It's all going to hit your lungs, and it's all going to hit the brain, and it all has this addictive component, which makes it very difficult to stop.
Thanks for explaining that. Because it sounds like, well, I mean, like all the addictions that I remember talking to people in health classes, you start getting it, and then you have to keep getting more and more and more to get to the same level that you were at initially.
That's true because our bodies adjust to it. And then, what we're talking about is what we call tolerance. And as our tolerance increases, our brain adjusts and demands more and more of the substance. So, it's like we start out at X and then we go to Y and then we go up and up and up. And that's a classic case of addiction where you start to see the tolerance build up. The brain is adjusting and demanding more and more of the substance to get the pleasure that we want, so that maybe smoking marijuana once a week got us high. And then that doesn't get us high anymore. So we go to twice a week and then 3 times a week. And then we start every day. And then we start multiple times a day. Those are all indications of what we call tolerance building, which is a classic indicator of addiction.
And probably something that then starts to tip off parents and grandparents to the fact that a teen may be having an issue with substances is by the time we start seeing it, it's probably because they're build up that tolerance and are using it more and more and more. So it's more chances for us to catch them, I guess.
It is. When it gets to that stage, it almost becomes obvious that the child has been using a substance because they've gotten to the point where they're using it so often, and the consequences, the negative consequences, have become rather dramatic that it becomes obvious. You don't want to wait as a parent or a grandparent to get to that stage before you recognize it. But unfortunately, a lot of parents do get to that stage because, as I think we pointed out, nobody ever told them what the warning signs are to look out for. So they get blindsided, and all of a sudden it becomes a crisis, and then they recognize there's a problem. And if they could recognize the warning signs early on, then I think they have a better chance of intervening at an early stage and not letting it get to the point where it becomes a crisis.
Well, and that's a good point as far as trying to do the intervention early, which is great. But I think with vaping, with edibles, I think with the classic alcohol and cigarettes, you can kind of catch on faster. But some of these other methods to ingest these things, what are some other than, almost being like in the prison and tossing your kid's room and checking under the mattress and looking under the shelves and all that kind of stuff. What are some things that parents should really be looking for?
I think it gets us back to where we look at what are the warning signs. So many parents don't know what the warning signs are because nobody told them what to look for. And it's one of the reasons why I wrote my book, The Addicted Child, A Parent's Guide to Adolescent Substance Abuse. I wanted parents and grandparents to know what those warning signs are, to be aware of what they are. um, because the earlier that you can catch this, the earlier you can intervene and keep it from becoming a real crisis. A lot of the warning signs come down to just, you know, n- noticing the changes that you see in your child. Parents and grandparents, they know these kids better than anybody. They've been around them. They know what's normal and what's abnormal behavior. So a big part of it is just don't ignore the changes that you see in your child. Don't assume that a child acting out, for example, it just might be adolescent be acting out behavior. Now, it could be, but it also might be a sign that there's something else going on underneath the surface that as a parent or a grandparent, you need to explore a little bit further. Let's say a child whose academic grades are starting to fall, a child who used to enjoy participating in sports no longer wants to do so. A child who becomes very secretive about where they are and what they've been doing. These are examples of warning signs that as parents and grandparents we need to pick up on and be curious about, and to have discussions with our children and our grandchildren about our concerns about what we're seeing. They need to be able to see that we're vulnerable, that we're frightened, that we're concerned, and share our feelings with them too. So if you're concerned about your child or your grandchild using drugs, have a conversation with them. Not the kind of conversation that says, well, are you using marijuana? Are you drinking alcohol? Have a conversation about, how the use of alcohol as a parent or grandparent scares you, how you're frightened about everything that's out there, and see if they'll open up and have a discussion with you about that.
That's great advice. And it's one of those things where I don't think anybody really looks forward to those kinds of conversations. It's almost like discussing sex with your kids.
Yeah.
It's going to be kind of difficult and awkward. But I love the approach of you're coming to them with concerns about what you're seeing. So it's not an accusation,
Right.
but it's like, hey, you loved baseball last spring and you were all about it. And now, you're not into it, whatever that favorite thing was. And it's more of, coming at it as a check-in. And
And that's a good example. You could very well have a discussion with your child or grandchild and say, I noticed last year that you were participating in this sport. You seemed to enjoy it, and now you've pulled away from it. Help me understand why. I'm curious. Help me understand why you're no longer interested. You're not telling them it's right or wrong. You're just saying, hey, I'm concerned. I'm curious. Help me understand what's going on. Help me understand why you don't participate anymore. They may have a very good reason, or it may lead to something else, or they may just not want to talk at all either.
Sure. But I like the example that you gave there, and it's something for, I think, all of us to remember is not to use yes, no kinds of questions in that discussion. It's
Those get nowhere.
Right. I mean, it's almost like asking your, fourth grader, how was school today? Fine.
It was okay.
Right.
It was okay.
I mean, that's what you're going to get. It's not going to be. So work on it. If you have trouble with those open-ended questions, maybe it's a good exercise for you and your friends to work on just asking each other those types of questions. So
and if you're concerned, keep the focus on yourself, not the child. Let them know that you're concerned. Let them know why you're concerned, and see if that'll open up a discussion or a topic they can talk about.
Sure. Talking about the marijuana, I wanted to circle around again to something that is pretty new to me, and that's this Delta 8. And I'd love for you to help define and talk about this a little bit more, because I know it's probably been around for a while. By the time I hear it, it's been around, but this is kind of new substance for me.
It is new, and it's not regulated. It's not illegal. The federal government is looking into it, so it may at some point become classified like marijuana, illegal to sell and illegal to possess. But right now it is totally unregulated, and it is legal. It's a psychoactive substance, comes from the cannabis plant. It gives feelings of euphoria and relaxation. Some of the downside is it can lead to symptoms like vomiting, hallucinations, loss of consciousness, memory loss. It's sold in the form of gummies. It can be vaped. It can be baked into brownies. A lot of the way that regular marijuana is used. It's not, like I said, it's not regulated and currently is not illegal. So it is definitely a substance that parents and grandparents need to be aware of. And like I say, it is being looked into, by the federal government, and it may be put on the same schedule as marijuana because it's so similar to marijuana.
Oh, sure. And, I think too is that when sometimes maybe we're walking around and we smell something that smells like marijuana, it might be this Delta 8 that's being smoked around.
Could be. Yeah, could be.
And yeah, so this is something definitely I think for folks to educate themselves a little bit more on is this Delta 8, especially, and being able to talk to it. Again, it's going back and having these conversations and having them earlier than maybe you expect about the different variants of some of these drugs that we're talking about.
Right.
One thing that's definitely been in the news for a long time is fentanyl. And
Yes.
I would love to know how most people that end up getting in trouble with it, how does that typically happen? Because I had some back surgeries in the last year. I've had 4 back surgeries, and I know when I went in each time, part of the process of putting me under was giving me fentanyl. Of course, very quickly, I didn't have the mindset to start asking a bunch of questions about it, from the anesthesiologist and the people. But fentanyl certainly in the news, but I'd love for you to talk a little bit about that and how this ends up getting into the hands of kids.
Well, fentanyl is a synthetic opiate. It's a painkiller, but it's a synthetic opiate. It's 50 times stronger than heroin, so it's very powerful. There is a pharmaceutical use to it, as you mentioned. It's used to control severe pain. It's used in some situations after surgery, and it's used in some cases for cancer patients who are in a lot of pain. So there are some legitimate uses pharmacologically for fentanyl to be used under the supervision of medical staff and a doctor. Unfortunately, it is also being distributed illegally throughout the country. Often it is mixed in with other drugs so that the person who's using the drug doesn't know that it's laced with fentanyl. And that is where a lot of the deaths are occurring. They're getting an overdose of fentanyl because it's laced in with other drugs. Some of the symptoms include pinpoint pupils, a loss of consciousness, reduced breathing, but it's the fentanyl deaths are what's really alarming in this country. It's becoming dramatic. And again, I think most of it is due to fentanyl being mixed in with drugs. So parents, grandparents, kids need to understand the extreme risk in buying drugs off the street. They're not pure. You don't know what you're getting. You might be thinking you're buying this drug and it's laced with fentanyl and you don't know it, and you take the drug and you overdose and die. So you never know. Whenever you're buying a drug illegally, you're buying it off the street, chances are it's not as pure as you think it is, and there is a potential it could be laced with fentanyl.
Man, it's scary stuff.
It is.
Even again, I'm going back to, and this is showing how old we are, the concern people had about marijuana cigarettes being laced with angel dust, PCP,
Yeah.
and how, scary that was societal and everything else. And the person ingesting it, of course, not expecting that, but having this mixed in, and especially when we also, and we talked about it last time, but with the drugs that are out there that are meant to treat ADHD and some of these other things that even college kids are using to stay up late and cram and because there's a lot of trading back and forth, and they may not be abused the same way as some of the other drugs, but again, to your point, you don't know what's in those.
No, you don't. I mean, if it's a prescription drug that you're abusing, like some of these stimulants that kids will use to stay up and study and things like that, chances are, because it's a prescription drug and you're overusing a prescribed drug, okay, it's probably going to be pure. It's not going to contain fentanyl, and it doesn't mean it's not dangerous. You're still abusing it, using it for the wrong reasons. But I would be more concerned about the drugs that kids are picking up off the street, that they're buying from dealers or they're getting from friends, and just being aware that there is a risk that it could be laced with a substance, maybe not fentanyl, maybe fentanyl, but it could be laced with a lot of other things too. Even marijuana, when it comes down the chain, chances are it's laced with something else too, if for no other reason than just to increase the quantity and make more money. But anytime you're buying a drug off the street, you run the risk that it's not pure.
Sure. And Rick, I've had you on for a little bit, and I've got a one last topic I want to touch on. But before we start to go there, is there anything else about this University of Michigan study? Is there anything else about some of the different drugs we haven't touched on that you would like to bring up with us?
We didn't talk about this, but except very, very briefly at the beginning, but the University of Michigan does also get information from these students about how dangerous they think these drugs are and how easy is it for them to get. I haven't seen the new data on it yet. It hasn't come out on those questions. But I can say that in previous studies, what we have seen consistently is two things. These drugs are readily available, and kids know it. So when we ask kids, how easy is it for you to get marijuana? The large percentage of them tell us it's no big deal. I can get it if I want it. We ask them, how easy is it to get alcohol? No big deal. I can get it if I want it. So these drugs are readily available, and the kids know about it. The other thing is we ask them, well, how dangerous do you think these drugs are? And they tell us they don't think that they're dangerous. They don't think drinking alcohol is a danger. They don't think smoking marijuana is a danger. So when you combine these two issues, the availability of drugs being readily available to these kids and they know it, and they don't think they're very risky, you have a perfect environment for some of the substance abuse that we see out there.
Oh, sure. Well, and what jumps to mind as you're going through that is I've been seeing both in social media and on television the ads for some of the different cannabis companies now that are talking about shipping things nationwide. It's a mom that's talking about how stressed out she is, and then talking to her father, who's probably in his 60s or 70s, with aches and pains, and she's telling him like, hey, you ought to be able to use this product. And, they go through that scenario. And if you're 15 or 16 years old and you're like, well, if mom's stressed out and she's ordering this stuff and taking it and being fine with it, I'm stressed out. I think that it's not the same messaging as it was when we were growing up is part of this.
Definitely sending a message that maybe it's okay.
Yeah.
Maybe it's okay.
Well, and I'd also say too, is if you are adults and you are using some of this, is making sure that you're keeping stuff locked up out of the hands, because it's easy for one or two things to go missing. The same way the old cliche from some of the movies where the kids were sneaking alcohol and, filling it back up with some water to put the volume back in.
That's a very good point, Greg, because I think it is important that if you're a parent or you're a grandparent and you have prescription drugs around the house, that you secure them. And I would say the same for alcohol. You need to secure the alcohol and any drugs, prescription, non-prescription, because kids are very clever. They'll get into them and they'll take just enough so that you won't notice that there's any missing.
So the last topic I wanted to touch on, and this is going to be maybe kind of an out of left field type of thing, but it's addiction with sugar and sugar products. And because we also see it too in the Michigan study, they talked about the caffeinated drinks, the Red Bulls, the Monsters,
Yeah.
whoever else. But I'm hearing more and more talk about how addictive sugar actually is and how it's combined in different products. And again, sugar's legal. Everybody's, it's in everything basically. But sugar and the sweeteners are definitely being used in vaping and alcohol and nicotine. Has anybody started to look at addiction with sugar outside of a dietary type environment?
We don't classify sugar as being an addictive substance yet, but we do know that Americans consume massive amounts of sugar, far more than that recommended by the World Health Association. And it is in so many different products. I mean, it would be difficult for anybody to try and reduce their sugar intake to a specified level because it's in everything. It has the same many positive effects on the brain. We enjoy it. It gives us a sense of feeling happy. It gives us, all of those addictive type of qualities that you get from drugs. But it's not classified yet as an addictive substance. I think it's more of a compulsive subject. It's difficult to get away from because, let's face it, everybody likes sugar, right?
Right.
You like sugar in candy, you like sugar in treats. And, if I were to tell you can never have any more sugar, your life would probably be pretty bland. But I think the problem is not the sugar itself. I think it's the massive amount of sugar that Americans have in their diet and how that can become a problem. The World Health Organization recommends, I forget the exact quantity, but it is substantially lower than what the average American consumes in sugar every day, either through food or soda or whatever. And I think it has the potential to become a problem for some people.
Oh, sure. And, I don't think we'll ever see it regulated the same way as we see alcohol and all that.
Right.
But at the same time, it's kind of interesting when we talk about the effects of the brain and the different things, and they may even be behaviors. I mean, you get into gambling and you get into some of these other things about what does that do and how does that light up, and then how does it control you and some different things.
Yeah, and like why do people take drugs? Because it creates a dopamine surge in the brain. They feel happy, they feel good. What does sugar do? It increases dopamine in the brain. It's just that the negative consequences of substance use, as opposed to the negative consequences of sugar, are dramatically different.
So, Rick, I've had you on for a while. This has been another great, informative discussion that we've had. I've always enjoyed these. I know you've got the book, The Addicted Child. Is there any other ways people can reach out to you, can follow you on social media, check out what you're doing if they want to reach out for more information?
Yeah, I think one easiest way is to go to the book's website, which is www.helptheaddictedchild.com, helptheaddictedchild.com. They can read more about addiction. There is some blog articles there that they might find helpful. There's one that is on 10 really easy questions that you can use to check in on your child's mental health. Parents and grandparents can use these questions to sort of get an idea, sort of a check on how well their child is doing with their mental health. And some of them are pretty fun. One, for example, is you can ask the child, if your feelings were weather, what kind of a day would it be outside? So there's their kind of questions. And there's some other articles too that people might find interesting. There's information on the book, The Addicted Child, A Parent's Guide to Adolescent Substance Abuse. There's a link that will take people to Amazon if they want to order a copy of the book as a Kindle or a paperback. And then there's a way in which they can send me a message or a note too, and it'll come to me.
Oh, that's great. And folks, what I'm going to do too is the last couple of episodes where Rick and I have been talking, I'm going to go ahead and put those links into the show notes for this one so that you can also go back, because some of the discussion is the same, but every year it changes. And certainly we dive into some of the other subjects in those conversations. So I want to make sure you have that. And Rick, I just really appreciate you taking time out of your day to come on, educate this grandpa about stuff that's happening so I can try to keep up with what's going on out there.
Well, thank you, Greg. It's a pleasure to be here. And thank you for the questions and the insight and contributing to the conversation. I hope that all of the audience, walks away thinking that, they learned a few things, and it was just a pleasure to be back with you again.
Oh, well, thanks. And have a good evening.
You too. Thanks a lot.
All right.
Bye-bye.
Bye. I really appreciated Rick coming on this year to talk to us again about the updated findings of the University of Michigan's annual study on substance use and abuse, especially amongst teens. I really appreciate the way that Rick can make these things simple for me to understand as a grandfather, and hopefully you as a parent or grandparent can really understand what's going on, where things are heading in terms of substance use and abuse amongst teens, as well as strategies to be able to talk to the teenagers around substance use, either that they're going through and currently doing, or just getting them prepared so that they're hearing messages coming from you, the family, about these substances and what they are, how they affect the body, how they affect the brain, as Rick talks about. Giving the kids the science behind what's going on seems to be one of the biggest ways that you can go to educate them and make sure that that information that you're providing to them is something that's going to stick. So it's not just drugs are bad, we don't like drugs. It's, hey, here's what they're doing to you, and here's why these things can be dangerous. I hope you found this conversation useful. Again, please go to Rick's website, helptheaddictedchild.com. Everything that Rick has there is available on that website, including ordering the book, The Addicted Child, A Parent's Guide to Adolescent Substance Abuse. This is a really good book. It's a short book, but it's packed with a lot of great information that Richard's provided to us, with a focus towards educating and talking about substance use and abuse with teens. So please go to those show notes, check that out, and please let myself or Rick know if you guys have any questions. You can comment on any of our social media posts. Also, comment on the websites and let us know if there's any way that we can help you out or provide more information for you. So I know this was a lot. I appreciate you listening to this conversation, and until next time, remember to stay cool. Thank you for listening to the Cool Grandpa Podcast. If you've enjoyed this episode, please do me a favor and share it with a friend. That's the best way you can help us to expand our community, as well as get the news out about how valuable grandpas are in the lives of those kids. If you'd like to leave me a comment or shoot me a potential topic for this podcast, please go to www.cool-grandpa.us. Look for the comments tab, fill it out, hit submit. It's as easy as that. Until next time, remember to stay cool.